Patient is oriented to person, place, and events, appears stated age, within recommended weight, BMI is equal to height and weight, states access to 3 meals per day, no obvious physical deformities, gait is even and regular, no involuntary movement, states name and age, denies use of assistive device, able to rise easy from a seated position, speech is clear and appropriate, English is primary language, mood and affect correlate with topic, clothes are neat and clean, good personal hygiene, patient appears pleasant and friendly, skin is uniform and matches ethnicity, warm, dry, and intact with no lesions, nails are pink and firm with negative profile sign, capillary refill is less than 2 seconds, the radial and brachial pulsations are strong and equal bilaterally, grip strength is strong and equal bilaterally, hair is brown, clean and evenly distributed, no lesions, lumps, or scaling of the scalp. Patient denies tenderness on scalp palpation. Head is normocephalic, temporal artery palpable and equal. Face is symmetrical, negative tenderness to frontal and maxillary sinuses. Cranial nerves 1 through 12 are all intact. Eyebrows, eyelids, and eyelashes are symmetrical without lesions or edema. Eyelashes are intact and equally distributed. Conjunctiva is pink, sclera is white, cornea is clear, iris is brown. Pupils are equal, round, reactive to light and accommodation. Cranial nerves 2, 3, 4, and 6 are intact. Vision, oculomotor, trochlear, and abducens. No masses or lesions or discharge of the ears. No tenderness to palpation. Canals are clear. Cranial nerve 8 is intact. Nose is symmetrical to face. Nares are patent. Mucosa is pink. No drainage. Septum is midline. Cranial nerve 1, olfactory, is intact. The lips are intact without lesions or ulcers. Buccal mucosa is pink and moist. Gums are pink and moist. Teeth are present and good repair. Hard and soft palate are both smooth with no lesions or masses. Tongue protrudes midline. No redness or exudate of tonsils and uvula. Cranial nerve 9, 10, and 12 are all intact. The trachea is midline, lymph nodes are palpated, and the patient denies tenderness. No inflammation or swelling noted. No lumps or visible pulsations on the neck. Carotid pulsations are equal bilaterally. No bruits heard on auscultation. Full range of motion against resistance. The thyroid's non-palpable and non-tender. Cranial nerve number 11 is intact. Thorax AP to T diameter is 2 to 1. Denies tenderness on CVA palpation. Resonance is a predominant sound. No use of accessory muscles to the anterior posterior chest. All lobes of the anterior and posterior thorax are clear to auscultation. No adventitious breath sounds heard. Respiration 16 per minute. The apical pulse is palpated at the 5th intercostal space on the left midclavicular line. S1 and S2 noted, no S3 or S4 noted. There's no visible pulsations, lifts, or heaves on the pericardium. The pulse is 72 beats per minute. The patient's abdomen is smooth skin with appropriate color to ethnicity, symmetrical with no lesions, scars, or striae. The umbilicus is midline. Bowel sounds were heard in all 4 quadrants, no vascular sounds heard. Tympany predominant sound. The abdomen was soft with no organomegaly or masses upon palpation, and the patient denies tenderness to light and deep palpation. The lower extremities are symmetrical with warm temperature, no lumps, bumps, or bruising. The hair distribution is even. All pulses were palpated and equal bilaterally. Full range of motion against resistance. The patellar reflex is 2+ bilaterally. Negative heel to shin test. Negative Romberg test. The upper extremities are symmetrical with no lumps, lesions, or bruises. Hair is evenly distributed. Skin temperature is warm. Full range of motion against resistance. The scoliosis screen is negative. Spine is in alignment. Posture is upright. Shoulder height, scapula, iliac crest, elbow gap are all symmetrical. Whew.